So the question is, how long do breast implants last? And that's a difficult question to answer. Historically, we've always quoted patients that expect your implants to last, on average, about 10 years. But with today's implants, it's probably more like 15 or 20 in our experience. And the reason to have them removed is typically one of two things as far as the implant is concerned. Number one, the implant can rupture. Number two, you can have what's called capsular contracture, which is scar tissue that forms around the implant. Those are the two implant-related late problems that can arise that would require removal of the implant. Now, the other thing that people have to keep in mind is that a lot of times patients will have revisions of their implants unrelated to the implant itself. And what I mean by that is that they may have 3 or 4 kids since they initially had their implants. They may have changed weight, and they may need to have a breast lift with a bigger implant or smaller implant, or they may just decide that they want to be bigger or smaller. So a lot of times patients will have a revision, 10 years later due to no problem with the implant. It's just the difference in change in their body. So when an implant ruptures, if it's saline, your body absorbs the saline and the implant goes flat and you know it. Silicone, on the other hand, because the body does not absorb silicone, you can have what's called intercapsular rupture, where that silicone stays within the confines of that scar tissue capsule, and the shape of the breast doesn't change, and the patient may not know that the implant is actually ruptured. That's why when the FDA first approved silicone, or I should say reapproved silicone gel implants back in 2006, they recommended that people get an MRI every 2 to 3 years to look for silent ruptures.